I am Anais Malpica, currently professor of pathology at the University of Texas and the Anderson Cancer Center in Houston, Texas. I'm the wife of a surgeon, the mother of 3 boys, the daughter-in-law of a very sick man who lives further away in Michigan, the sister of a mentally ill man who lives in South America. I am the mentor of a good group of very enthusiastic GYN pathologists all over the country. I have been a great teacher, a disciplined mother, a good wife, a good daughter. All of a sudden, I turned 54 and my life was upside down. I had problems to concentrate, lack of energy, I was feeling sick, my hair was falling off, my fingernails were breaking, and I had to deal with my constant demands. I was getting cold, I was getting impatient. I had problems with my heart rate. I could not exercise. I could not focus. I could not answer to many questions, and especially I was feeling frustrated. 2 physicians, friends of mine, who happened to be my physicians, had seen me. One a wonderful cardiologist, the other one a wonderful gynecologist. And everything that I had was related to stress. Yes, you live a very stressful life. You're a very successful woman. You're a very demanding person. That's what is happening to you, stress. Stress is killing you. You should drop everything that is stressing you, and then you're going to feel better. And initially, I said, could this be related to menopause? Could this be related to thyroid disease? And I was told, well, your basic thyroid function tests are totally normal, and we do not see anything wrong with you. You are essentially a victim of stress. I was getting sicker and sicker until December of 2014, when I said, I really have to be sick, because I'm seeing a friend of mine who is 76 years old, and this woman is behaving like if she were 54 years old, and I was behaving as if I were a 150-year-old woman. I decided to look for help, and I happily came to see Dr. Aaron, who essentially took care of me. He put me on a thyroid recovery plan, which included multiple medicines. I underwent the very thorough testing process, and this is me 6 months after completing the advice and the therapy that I was given. Essentially, I have recovered myself. Nowadays, I feel that I had to speak on behalf of all those women who have been dealing with this disease and who go around being undiagnosed. I just wanted to say thank you to Dr. Aaron, and hopefully you can continue your mission, helping other women who are just going around being told that they're just victims of stress. It makes me cry to think that people are just going around suffering from this condition and being told that they are under stress, that it's life, that it's just menopause, that they're just losing it because they are hyper competitive and they got themselves on this particular situation, which represents a trap, a situation where you decided to pursue an academic career, a professional career, and then you're at the very top of the game and you're losing ground. Your demands at home increase every day because your children, it's true that they grow and they need less of you, but intellectually they need more of you. Emotionally, they need more of you. And unfortunately, you're in a situation where you cannot help anybody because you're trying to figure out what's wrong with you. I can say that people are going around being underdiagnosed of thyroid conditions that are killing them because they are losing themselves, they are losing who they are. And the societal cost of these women who are being lost, or men who are being lost, because the condition is under-recognized, is huge, and unfortunately I don't think there is enough knowledge in the medical community, let alone in the society, to deal with this problem. So please, if you feel that you're losing yourself, look for help. And at this point I would say that I have got the help that I needed in this Thyroid Institute that is run by Dr. Aaron. This is all what I have to say. Thank you.